Well, today we're talking about orthopedic pain and what we can do during the pandemic. A lot of times there are delays in elective surgery because the surgeons are needed elsewhere, obviously. But what can you do?
You know, that is what we are seeing, Nona. I mean, obviously, we went through what we went through last year with COVID. And when we went through everything that we went through last year, we had the shutdown, and we had no elective surgeries being done, and we saw the effect of that. And, you know, just to kind of give us a little bit of background as to so that everyone, so our listeners can kind of understand why we're doing this and the importance of why we're presenting it this way is the shutdown last year and the isolation not only affected those that were sick, it affected those that weren't sick. It affected those that were waiting on an elective surgery to have a hip replacement or a knee replacement, or to have back surgery or to have foot surgery or shoulder surgery. So the effect that it had was more than we imagined that it would be. It wasn't just, okay, here's a little delay and we'll get back. What we found is in our older population, they're still trying to recover from that downtime that they had where they were isolated and whenever they weren't active. And for those that could not get a hip replacement or a knee replacement on time, it wasn't just, okay, well, you know, you were delayed by 2 months or 3 months, so you're 2 to 3 months behind. What we have found is it's been significantly more impactful than that because the loss of function and strength was more profound. And then the isolation and the lack of activity, along with the mental component of being isolated and the depression and anxiety associated with it, we've seen so much more of a dramatic effect on what's happening with people because of delays either in surgeries or normal activity and normal lifestyle. So looking back at last year and then projecting forward to this year, we really didn't expect to kind of be in another position where elective surgeries may be put on hold. But with the Delta variant and with the numbers as they are, any surgery, and obviously I'm speaking in generality, so I don't want to alarm anyone and make anyone say, oh, no, I'm not going to get to have my surgery. In generality, hospitals are starting to evaluate, should we be doing these elective surgeries that require hospitalization if you are going to be exposed to COVID or Delta? And what if we need those beds with Delta with the numbers as they are? So there is that point where things are starting to really be strongly evaluated in regard to elective surgery. So looking at last year and looking at the losses and the impact that was had, we wanted to look at it from a physical therapy and occupational therapy standpoint and say, okay, what can we do to minimize that downside, to create almost like a lateral move so that we can maintain what someone has and maybe even gain a little bit more ground and allow some pain relief as someone is waiting on that elective surgery or someone is waiting on that appointment with that orthopedist. So we have worked with the orthopedists in our community to create that relationship where they can trust that we're going to be mindful that, you know, this person needs a hip replacement. So we know the things that we can do to help with that hip. Not that we're going to prevent the hip replacement, but we can prevent the atrophy, the weakness, the loss of function, the loss of balance, the risk of falls, the deconditioning, which is a fancy word for just losing strength and endurance. All of those things that we saw happen last year, we're working with those orthopedists this year to be that piece of the puzzle that you can get into right away so that you're not going to look at that same downside and that same risk of loss and the negative associated with that. So at Excel Rehab and Sports, we want to be that resource that you can call us and say, okay, I'm going to need this hip replacement, but I can't get in and see my orthopedist for 2 months. I don't know what I'm going to do. I can't walk. I have to just sit. I can't go up and down stairs anymore. What should I do? And we are that resource that you can confidently go to that's not going to talk you out of having a hip replacement, but that's going to make that process better going into it. You'll be better prepared. We can help you control the pain. We can prevent injury associated with falls, and basically just kind of be that that component that can work alongside that orthopedist to have more availability and not have the same limitations in regard to what we can do because of Delta.